Our poster is entitled The Impact of a Standardized Transabdominal Plane Block Preoperative Educational Protocol for Abdominal Surgeries on Patient Experience and Postoperative Pain. My name is Haley Sharn, and I am joined by my teammates Madison Askew, Alessandra Mangione, and Reese Weaver. Our project site is the Tuscaloosa Surgical Center, which patient abdominal surgeries. However, the literature shows that outpatient surgeries are associated with decreased time dedicated to patient education, in our case about TAP blocks, which is a regional anesthesia technique that helps to manage a patient's postoperative pain and decrease postoperative opioid use. However, with this inadequate patient education that's occurring, patients are not able to make informed decisions about whether or not to get a TAP block, which can lead to postoperative consequences. The purpose of our project is to implement an educational protocol to increase patient education on TAP blocks and therefore increase their patient satisfaction.
Implementation of this educational protocol focuses on three key components. First, an educational pamphlet on TAP blocks is given to patients by the operating surgeon at their pre-admission appointment. It explains the who, what, where, when, why, and how of the procedure. On the day of surgery, the anesthesiologist will review this pamphlet with the patient and confirm understanding while obtaining consent. Second, a Likert scale survey is provided postoperatively by nurses with instructions to complete it within 24 hours. This survey assesses patients' familiarity with TAP blocks, their sense of preparedness, and the quality of communication with their providers. A staff checklist is added to patients' charts to ensure each team member fulfills their role in delivering consistent, thorough education. Inclusion criteria for the protocol are patients aged 18 and older, English speaking, and scheduled for abdominal surgery during the study time frame.
The primary implication for our poster is to increase patient satisfaction. With this accomplished, our team proposes that patients will be more likely to use the surgery center again or refer it to others. This will contribute to an increase in revenue for the surgical center and long-term facility success. Additionally, we believe that a more educated patient will understand the role that a TAP block in postoperative recovery, thus needing a lower amount of narcotics. Decreased narcotic administration will aid in a reduction of adverse events such as patient falls. These points aid in project sustainability as pamphlet production is relatively low cost compared to costs associated with postoperative medications and adverse events.
To analyze the pre- and post-implementation data, descriptive statistics and t-tests were used. Average opioid usage of oxycodone, Dilaudid, Demerol, Morphine, Toradol, and Norco, and average numeric pain scores on a 0 to 10 scale were analyzed pre- and post-implementation. Post-implementation, the usage of oxycodone, Dilaudid, and Norco and numeric pain scores decreased, with an average pain score of 1.7 out of 10. The Likert survey data from the post-implementation group could obtain a maximum score of 50, signifying that patients strongly agreed that they learned helpful information about TAP blocks from the pamphlet, what their recovery would look like, and the absence of stress before and after surgery, and pain was easily controlled. With our TAP block pamphlet, the average survey score was 47, with scores ranging from 43 to 50.